Hello, I'm Erin Masters, Clinical Coordinator and Educator for Spartanburg Regional Healthcare System. Thank you for choosing Spartanburg Regional Healthcare System for your joint replacement surgery. Welcome to Part 2 of our Total Joint Camp video series. The Total Joint Camp was developed to walk you through every step of your joint replacement journey, including how to prepare, what to expect, and what to do to ensure the best possible recovery. In this video, we will share information about your hospital stay from the day of your surgery until you are discharged to go home. The information presented in this video series can also be found in our Total Joint Replacement Patient Guide. This important guide serves as a comprehensive resource of education and information for you from the very beginning of your joint replacement journey and beyond. Enhanced Recovery After Surgery, also known as ERAS, is a modern treatment program for surgical patients used by our joint replacement team. The goal is to help you return to a healthy state as soon as possible after surgery. Every part of our joint replacement program has been carefully planned and orchestrated as part of the ERAS treatment plan. Achieving the best surgical outcome for you is our number one goal, and the process from this point forward can be described using the acronym DREAMS. Let's take a closer look. Drinking water will keep you hydrated for faster healing and reduce constipation. Reduce stress. You will receive medications to decrease your body's stress response from having surgery. Eat. You will be given crackers to eat soon after your surgery, and your food intake will progress as tolerated. You will be encouraged to eat protein with every meal to help your body heal. Analgesia. We will give you medications and anesthesia before, during, and after your surgery to help manage the amount of pain you experience. Move. You will move to improve after surgery. We will get you moving as soon as possible after surgery to promote circulation and healing. Sleep. Your body needs rest to help it recover. We use dreams to get you back to you as fast as possible. On the day of your surgery, you will enter the perioperative phase. On your surgery day, arrive at the scheduled time and check in at the surgery waiting area. When your name is called, you will be directed to a pre-op area where a registered nurse will greet you and give you a gown and special socks to change into. The nurse will help you get comfortable and review information obtained during your pre-admission testing appointment with you. Then, your nurse will place an IV in your arm to start IV fluids and an antibiotic, and you will receive a tuberculosis skin prick test, which is a DHEC requirement. You will also receive medication for pain and nausea before you go to the operating room. Someone from anesthesia, as well as an OR nurse, will introduce themselves and review your information, answer questions, and provide explanations about what happens next and what you can expect. Almost everyone you meet on this day will ask for your name and date of birth. This is not because they don't know it, but as a safety precaution for you. There are several anesthetic techniques available for total joint replacement. The three most commonly used are spinal anesthesia, general anesthesia, and peripheral nerve block. Spinal anesthesia is the preferred choice for hip and knee replacements. Anesthetic is injected near the spinal cord to block pain from an entire region of the body. This technique is used in conjunction with IV sedation and a peripheral nerve block. General anesthesia is preferred for shoulder replacement surgery. While the patient is unconscious, a breathing tube is placed in their windpipe and the anesthesiologist delivers an anesthetic gas through the breathing tube. This type of anesthesia affects the entire body, brain, and nervous system, leaving the patient in an unconscious state during surgery. A peripheral nerve block is sometimes used to help decrease pain after surgery. A local anesthetic is injected near a specific nerve or group of nerves to block pain from a specific area. Before your surgery, the anesthesia team will talk to you about the details of your anesthesia plan. The OR staff may again ask you a few questions, such as your name, birth date, allergies, surgical site, etc. The anesthesia specialist will then guide you through the sedation process, and your surgery will take place. A Foley catheter may be inserted into your urethra for urine output once anesthesia is administered. Total hip and knee replacements generally take between 1 to 3 hours on average. Your family can wait in the surgical waiting area and they will be updated periodically on your condition. Now that your surgery is complete and you are on your way to being a brand new you, the postoperative phase begins. When the procedure is over, your surgeon will come to the surgical waiting area, if possible, to let your family know how the surgery went. The operating room staff will move you from the operating room to the PACU. PACU stands for Post-Anesthesia Care Unit, otherwise known as the recovery room. While you are in recovery, a nurse will assess your status and vital signs on a constant basis. They will remove the Foley catheter and IV tube and continue to administer pain and symptom management. The PACU nurse will encourage you to begin eating and drinking. Once you are stable and a room is available, you will be transferred to the orthopedic unit. To keep you informed and engaged in your care, we have a care board in each patient room. These dry erase boards list important information about your care team and treatment plan, such as staff names, contact information, therapy plans, and pain management details. Each room is equipped with call lights that are easy to reach, so you can ask for assistance at any time. For your safety, we ask that you use this call light to request assistance every time you need to get up. Please be sure to bring cases and containers to keep in your room for any removable dental appliances, dentures, glasses, or hearing aids. There will be a blue folder in your room that contains a patient information handbook, TV guide, and other information that may be helpful during your stay. Our orthopedic units are dedicated to the specific needs of orthopedic surgery patients. This includes private patient rooms, a 24-hour nursing staff of nationally certified orthopedic nurses. Therapy is available 7 days a week. Nurse leader rounds on all patients, and providers wear ID badges for easy identification. Your body starts to lose strength after only 1 day in bed, so the more active you are after surgery, the stronger you will be and the quicker you will recover. A process called progressive mobility is a part of the Enhanced Recovery After Surgery, or ERAS plan. The first step starts as soon as 2 hours after surgery, when you will sit up on the edge of your bed. Additionally, you can expect to be sitting up in a chair for all meals and as much as tolerated between meals. Your care team will work with you to move to improve during your hospital stay. While we encourage you to be as active as possible, a member of our staff must be with you when you get in or out of bed. Use your call light to ask for assistance every time you get in or out of bed. A case manager will come by to discuss your discharge plans and assist with acquiring any equipment that might be helpful for you at home. They will also set up home health or rehab as needed. You will be encouraged to eat and drink to aid the healing process. Protein supplements may be provided with meals to help with your post-surgery nutrition needs. Surgical site infection prevention will be an important part of your recovery. Eating a healthy diet, staying hydrated, and getting adequate rest are important to keeping your immune system working well and aid in your recovery. Avoid picking, scratching, or pulling at your incision, and don't use oils, lotions, or creams on or around your incision unless directed by your surgeon. Hand washing. Everyone, including doctors, nurses, and you, should wash their hands before touching or caring for your incision. The 4 main vital signs, blood pressure, heart rate, respiratory rate, and body temperature, reveal a lot of critical information and are an important component of patient care. After surgery, your vital signs will be taken on a set schedule. It will start every 30 minutes for 3 occurrences, then once an hour for 3 occurrences, and then every 4 hours for the next 24 hours. After that, your vital signs will be taken every 8 hours. Please be aware that this will involve being woken up at night. We know this can be frustrating, but it is imperative to ensure you are not having any complications from surgery. Blood clots are a serious and preventable condition in patients who have undergone recent surgery. They are primarily caused by poor blood circulation due to spending a lot of time in bed after surgery. Deep vein thrombosis, or DVT, occurs when a blood clot forms in the deep veins, most commonly in the arms or legs. An occurrence known as pulmonary embolism, or PE, can occur if a DVT breaks off and travels to the lungs. Our surgical team utilizes 3 important strategies to reduce the risk of blood clot formation. The first one is walking. Walking, even just a little bit, is important for circulation and the prevention of DVT. The second component is sequential compression devices, or SCDs. These are sleeves placed on your feet or legs after surgery. They will inflate and deflate in a rhythm to assist with circulation while you are lying down or sitting in a chair. The third tool is compression stockings, which also promote better circulation. During your hospital stay, you will have around-the-clock nursing care. The orthopedic nursing care team will round regularly to ensure your needs are met. The rounding schedule is every hour between 6 a.m. and 10 p.m., then every 2 hours from 10 p.m. to 6 a.m. If we notice you are asleep during rounds, we will do our best to not wake you unless a medical order requires it, such as checking vital signs or giving medications. After your surgery, you will receive a breathing tool called an incentive spirometer. This tool is used to encourage deep breathing and prevent the pooling of fluid in the lungs, which can cause pneumonia. It is strongly recommended that you use your incentive spirometer for 3 to 4 breaths every 15 minutes with a goal of at least 10 times every hour while you are awake. After surgery, you should expect to have some postoperative pain. Our goal is to control the pain at a level that allows you to rest as well as participate in your physical therapy. Pain is one of the biggest concerns for anyone having surgery, and we want you to know what to expect. First, you will have pain after surgery. Our goal is to keep your pain managed at a level you can tolerate and still function properly. Your physician will order different types of medications that will be available depending on your level of discomfort. It is important for you to know that medication is not the only option we can offer for pain relief, and our staff is expertly trained in alternate pain relief strategies. We care about how you feel, and you will be asked very often about your pain level using a 0 to 10 pain scale. The pain scale helps us rate your level of pain by linking the way you feel to a set of numbers from 0 to 10. 0 is no pain, and 10 is the worst pain imaginable. As we said before, you will be asked on a regular basis to rate your level of pain. Pain medication will be provided as needed, so keep your nurse informed about how you are feeling. Types of pain medications include IV opioids. These are narcotic medications such as morphine that are given through an IV and are indicated for severe pain. Oral opioids are narcotic pain medications that are taken by mouth. They are also indicated for severe pain. Some commonly used oral opioids include oxycodone, fentanyl, codeine, and Dilaudid. Anti-inflammatories. This class of pain relief drugs are also called NSAIDs, or nonsteroidal anti-inflammatory drugs. They reduce pain by decreasing inflammation in the body. Some commonly used NSAIDs are ibuprofen, Celebrex, Toradol, and aspirin. Typically, IV pain meds are only used shortly after surgery, and you will transition to oral pain medications to control your pain when you can tolerate fluids and food by mouth.
Your case manager will take care of your discharge planning. Before you can go home, plans need to be made to decide things like when you can leave the hospital and what you will need when you get there. Your case manager will meet daily with your care team to monitor your progress, and if everything is going well, you should be able to go home 1 or 2 days after your surgery. In the meantime, your case manager will order any medical equipment you might need and arrange for home health and physical therapy visits if appropriate. As we have mentioned before, it's a good idea to contact your insurance company prior to having surgery, and if you have Medicare, there are a few additional things you might need to know. Total knee and hip patients are considered observation status and not inpatient status. This change was made effective January 2018 for knees and January 2020 for hips, and it will affect how much you pay for some hospital services. Medication billing can be submitted to your Part D Medicare plan for a possible refund. Observation status under Medicare does not cover skilled nursing facility stays following your hospital stay. To meet inpatient qualifications, your physician will determine if it is medically necessary for you to spend more than 2 nights in the hospital.
Hi, I'm Noelle Sublett. I'm a physical therapy manager at Spartanburg Regional Healthcare System. Today, I'd like to talk to you about what to expect from physical and occupational therapy after your joint replacement. It cannot be stressed enough that active participation in physical therapy is one of the most important aspects of your successful recovery. You will work with therapy twice a day, morning and afternoon, for the first 2 days after surgery. If you are still in the hospital on the 3rd day after surgery, the frequency of your physical therapy may be adjusted according to your needs. Soon after your surgery, you will meet with a physical therapist. Your physical therapist will evaluate your strength, range of motion, safety, ability to safely transfer in and out of bed, and ability to walk. He or she will also discuss your home environment, prior level of function, and recommended equipment. Physical therapy activities include strengthening exercises, getting in and out of bed, standing up and sitting down, walking with a walker or other device, and negotiating stairs or going up and down the stairs. Your therapist will work with your case manager to ensure you have the proper equipment before you return home. Physical therapy is the key to your recovery, and it is the key to getting your motion, strength, and mobility back. In the interest of full disclosure, we must tell you that physical therapy hurts. You should ask your nurse for pain medication on a regular basis. Physical therapy is hard work, and each day your therapist will ask you to do a little more on your own. Why is therapy so important? Our goal is to help you reach the necessary milestones that will allow you to go home and get back to doing the things you love. Occupational therapy is also referred to as OT, and it will prepare you to complete activities of everyday living while you are recovering from surgery. Your occupational therapist will teach you how to use adaptive equipment and special strategies that will protect your new joint as you go about your daily routine, such as putting on shoes and socks, reaching for things, and taking a shower. Our goal is for you to be safe and independent.